Everybody, my name is Kevin Fagundo Heda. I'm a PhD student of urban planning at the University of Utah. Professor Ibis Garcia is my PhD advisor, and today we're going to present our research titled Health-Related Nonprofit Response to Concurrent Disaster Events in Puerto Rico. So we couldn't have done this project without the help of our professors and colleagues, Divya, Emil, Jose, Kayla, Carlos, and Pablo. So for today, I will be talking about what the literature tells us about nonprofit organizations. We will be talking about our project, the methods that we use to collect data, some of our findings, and the implications for public health. So first of all, I'm going to talk about backgrounds and nonprofit organizations. So the literature tells us that nonprofit organizations are well positioned to provide services in disaster contexts. This is because nonprofits are adaptable, they're agile, and have responsive institutional structures. However, in the past 4 years, nonprofits in Puerto Rico have been challenged by multiple natural and public health disasters. So to frame our project, we developed 3 main research questions. So these questions are, first, how were nonprofits affected by concurrent disasters? How did they resolve competing priorities in the face of these events? And what specific lessons have they learned regarding disaster preparedness and recovery? So we chose Puerto Rico as our case study. We looked at long-term recovery in Puerto Rico after Hurricane Maria, well, after 2017 hurricanes Irma and Maria. We looked at the 2020 earthquakes and the current COVID-19 pandemic. So in order to gather data, we developed a survey which we administer by phone and online. So we had 96 responses, and the organizations that participated in our project had an average of 43 full-time employees. Our sample was representative in 17 out of the 25 NTE sectors. 14% of them were in the healthcare sector, 93% provided services during the hurricane, 60% during the earthquakes, and 99% during the COVID-19 pandemic. So we complemented the surveys that we did at the beginning with in-depth interview with nonprofit organizations in Puerto Rico. So we currently have 20 interviews, which are still ongoing. Most of our participants are at the executive level. 50% had worked in the organization for more than 10 years. 77% identified as female, and 10 out of these 20 organizations are in the healthcare sector. So we want to discuss with you today 3 main findings in our project. So first, we want to talk about the impact that these disasters had on the operation of these nonprofits. We want to talk about their adaptive responses, and we are going to talk about what they have learned in the past 4 years. So first of all, regarding the impact of disasters on nonprofit operations, we found that the 2017 hurricanes and the COVID-19 pandemic had a bigger impact than the 2020 earthquakes. We also found that when dealing with the hurricanes, the most significant challenges was funding, with the earthquakes was bureaucracy, and with COVID-19 was the delivery of services. Overall, we found that bureaucracy and funding was a challenge consistent across all disasters. As you can see in this graph, there's a visual representation of what I just told you. Right here in funding, service delivery, and bureaucratic hurdles, you see that they're very significant for nonprofits in Puerto Rico after the disasters. And as I mentioned before, our findings from the surveys were complemented by interviews. So as you can read in this quote, this participant told us that after Hurricane Maria, many doctors and many nurses left the island due to water and electricity shortages. So basically finding employees and volunteers was definitely a significant challenge for a lot of organizations. So in terms of adaptability, our second finding, we found that the biggest change that nonprofit had to make during the pandemic was the population they served and the services they provided. We also found that after Hurricane Maria, a significant amount of organizations had to change their mission and their vision. As you can see here, this is another visual representation. The colors are the disasters and the three main factors. So this participant in adaptive response told us that in order to adapt to concurrent disasters, they had to rethink their mission. This participant shared that during the pandemic, they had less funding and resources available to them. So they had to prioritize what their community needed the most at the time. So in the third finding, which is organizational learning, we found that organizations need to be more agile when taking decisions. They had to build network capacity, and they had to develop disasters plans for improved response capacity. So in the first one of organizational learning, which is decision making, we found that organizations develop a more certain organizations develop a more horizontal decision-making process. They had multiple people who could take decisions, important decisions during disasters. This participant, this one specifically right here, shared that they started doing focus groups with the staff in order to understand their needs and get their feedback. In terms of networking for capacity building, many organizations outlined the importance of education. This participant right here told us that their organization collaborates with organizations across multiple Latin American countries. So basically, they collaborate with other organizations in other countries in order to learn how other countries prepare and respond to disasters. So in terms of operational plans, this participant shared that the organization studied disasters plans developed by federal, state, and municipal agencies and adapts them in order to, meet their needs and, satisfy the needs of the community. And for the implications for public health, we think that our research can inform public health agencies when engaging with nonprofits outside of the healthcare sector. Second, our research emphasizes the need to build partnerships between organizations in area where there are few organizations existing. Third, organizations share the importance of mental health services and training for staff in order to address burnout. And lastly, our findings encourage a more, agile process when networking between nonprofits and government agencies. So the research that I just presented to you would not be possible without the help of the Natural Hazard Center, the Center for Disease Control, and the National Science Foundation, and with everybody that responded to our survey and to our interview. So thank you very much for attending and for listening to me.